I'm Paolo Lanzetta from the University of Udine. I'm a retina specialist. I've been involved in the retina field in trials and treating patients for about 30 plus years now. As soon as aflibercept 8 milligram became available in Italy, we were really keen to look at the early effects in terms of visual acuity improvement and in terms of morphology improvement. In other words, seeing the effects on the retinal fluid, or in other words, the drying effect. So what we did was to pick up a number of patients. We have now more than 30 patients being treated with aflibercept 8 milligram. Some of them were naive, some of them were switched from previous therapies, and we look very closely at the early effects, which means patients were monitored after 1 day after the injection, 7 days, 14 days, 30 days, 60 days, and then 90 days, which means after the loading phases with 3 consecutive monthly injections. And what we see is really very interesting. It's something we do not usually see. In fact, with respect to the total improvement in retinal thickness, which we did see in 90 days, 30% of that improvement was already visible at 1 day. And 7 days later, 1 week after the first injection, that improvement was by 70%, which became basically 90% of the resolution of the total fluid by 1 month, which means after a single injection. And this also corresponded to a very early improvement in visual acuity, which was 4 letters, almost 1 line after 1 day, and went up to 11 letters at day 90, which is the monitoring visits after the 3 loading injections. Well, in general, patients do immediately realize some improvement in their vision. This is due to the fluid reabsorption. In terms of daily life, those patients who have relatively good vision at baseline after the treatment, they refer about improvement in reading capacities, in driving their car. So there is an immediate effect, and we know from trials that this early improvement in visual acuity and this early drying effect translates in the long term. We have now 3 years data. We show a sustained and robust effect after being treated with aflibercept 8 milligram. Well, first of all, patients are satisfied. We as physicians are very satisfied on seeing these on monitoring visits through visual acuity measurement and OCT monitoring. This early effect coupled to the durability effect aflibercept 8 milligram is also showing in our treated patients is a big comfort, again, to ourselves physicians and obviously to the patient. When dealing with a pre-treated patient to whom you propose to transition to a newer drug, we have the advantage of some better knowledge from the patient perspectives, because they know the burden of repeated and frequent injection eventually, and they very easily understand the potential advantage of having extensive interval in between injections. When you talk with naive patients, you have to go through different phases, which is let them understand the disease we are facing, and we are trying to treat with newer therapies. And in terms of burden, most of cases are chronic disease, DME, or even AMD patients. They have a kind of a chronic disease, so they do understand that they will need repeated injection. And if you pose different alternatives in favor of a medication which needs less injections over time, they definitely prefer the reduced burden with this possibility.